Good morning. Welcome to Salina Regional's Morning Medical. Today's program we're going to be talking about migraines. With me I have the newest neurologist to Salina Regional Health Center, Neurosciences, Dr. Doug Davis. Thanks for being on the show. As I mentioned, you are new, so first of all, let's hear a little about yourself.
Yeah, well, thanks for having me, Mike. I'm a Kansas/Southeast Colorado boy. I grew up in Southeast Colorado, in Hawley, Colorado. And then I did some undergrad out here at Sterling College, actually. That's where I got my undergraduate degree. And then I taught high school in Syracuse, Kansas for about 7 years.
Like I mentioned, we were talking about migraines, or going to be talking about migraines. Are they just a bad headache? What is a migraine?
Just a bad headache starts it out, but there are some criteria for migraines. Most migraines are a throbbing type of pain as opposed to like just a squeezing or pressure type. And most of them are unilateral, meaning they're on one side of the face or the other side, but they can be both. And then there's a lot of associated symptoms with migraines that kind of help classify them.
So we've determined what a migraine is. How about treatment for them?
Well, it's an exciting time in neurology in general. There's a lot of new treatments coming out, and migraine's not immune to that. There are several new treatments coming out, both medication-wise and just therapy-wise. There's 2 new medications that have been approved by the FDA recently, one in the past several months and actually one in the last couple weeks, that is a once-a-month shot that patients can take that help with the migraines, as opposed to the Botox shots, which we do every 3 months, or a daily medication.
Well, what's one of the importance of having new treatments for migraines other than just finding a pain relief?
Right, and a lot of the treatments we have now that have been used previously, like narcotics or opiates or even over-the-counter medications, aren't ideal for chronic daily headaches or migraine headaches. They can actually make the symptoms worse.
So it sounds like the new treatments are more than just masking or taking care of the pain. They're actually providing some relief and some future relief, right?
Mm-hmm. That's correct. So there are 2 different types of headaches. There's primary headaches, which means that there's nothing necessarily causing those headaches that we know of, and there's secondary headaches. The secondary headaches, we look to the cause and we try to treat that as opposed to treating the headache. But for chronic migraines, we have 2 different medications that we can use. One is an abortive medication, and another one is a prophylactic medication, which we give you on a daily basis to try to prevent those headaches from coming on.
Okay, thank you so much. Thank you for being on the show. Thank you for watching. For more information, please visit srhc.com, like us on Facebook, and follow us on Twitter.